This contract also addresses clinical services to be offered to the Turks and Caicos Islands residents and persons who come to visit the Turks and Caicos shores. And in doing so, we have ensured that we have a high degree of professionalism within the clinical services component to meet the demands of healthcare needs for the people of the Turks and Caicos Islands. That I am very happy about.
That was 2 years ago when InterHealth Canada secured a government contract to build and operate the 2 new hospitals of Grand Turk and Providenciales. And today, News 4 can reveal from reliable sources within InterHealth Canada that construction work on the hospital is nearly complete and it will be ready for the projected opening date of April 2010. Sources revealed that already the Chief Operating Officer, or CEO, Roger Cheeseman, who will be overseeing the operations and management of the hospital, has been on island for a number of months. Sources also revealed that the hospital's Chief Nursing Officer and Training Officer are both in Turks and Caicos and have begun training courses with locals who are contracted to take up jobs at the new health facilities. News 4 was told that nearly 95% of the TCI's current healthcare providers who applied for positions at the new facilities were taken on by InterHealth Canada, also contracted to provide staffing at the new hospitals. The informant told News 4 that while the hospital will represent a new dawn for healthcare in Turks and Caicos, there are limited administrative positions, telling News 4 that high-ranking medical physicians and administrators are being recruited from Canada, the UK, the United States, Australia, and New Zealand. Quote, "Where new expertise is needed, we certainly will be bringing it from outside. We are recruiting by quality and experience, not by nationality," end quote. In December of 2007, former Ministers of Health Lillian Boyce and Floyd Hall signed an intricate contract with InterHealth Canada, Johnston International, and First Caribbean Bank, authorizing funding, construction, staffing, and management of the Providenciales and Grand Turk hospitals. The joint venture is a public-private partnership which encompasses TCIG, InterHealth Canada, and a number of financial institutions, which provided over $125 million for the construction of the facilities. The construction of the 2 healthcare facilities, as noted by the then Ministers of Health, would provide quality medical care for local residents, clinical services, and streamline the current cost of health care currently being paid for by the Turks and Caicos Islands government. The hospitals will provide primary and secondary care to patients, pre-operative assessments and preparation, diagnostic imaging, laboratory investigations, inpatient care of admitted cases, and pharmaceutical care. The hospitals will add on an additional 20 beds to Grand Turk and 60 beds to the Providenciales facilities. With the completion of the massive healthcare facilities comes the National Health Insurance Plan, which has been facing tough critics questioning the principles behind it and noting that its demands of 2.5% of one's salary are a bit much for what the plan is actually providing. InterHealth Canada was behind the Royal Hyatt Women's Hospital in Kuwait and the Dasman Center for Diabetes Research Center, also in Kuwait. For WIV4 News, I'm Angie Toussaint.